We have some wonderful panelists today. I mentioned Iris Harvey. Iris Harvey is the president and CEO of Planned Parenthood of Greater Ohio, a 501c3, and Planned Parenthood Advocates of Ohio, a 501c4. In this position, she provides visionary and collaborative leadership to the organization's healthcare delivery and financial operations of 17 health centers throughout Ohio. As CEO, Iris also oversees government relations, public policy, and patient and supporter advocacy. Planned Parenthood of Greater Ohio provides comprehensive health care to nearly 65,000 unique patients and over 90,000 annual patient visits. So I sincerely hope that she's able to join us because, like I said, I was very much looking forward to hearing from her. I also want to introduce to you Dr. Elysia James. Dr. James is an assistant professor with the Department of Neurology at the University of Toledo College of Medicine and Life Sciences and a practicing neurointensivist in the ProMedica Toledo Hospital Neuro ICU. Her passions include the provision of high quality patient care, mentorship, and themes related to social justice and societal change. She was born and raised in Ajax, Ontario, Canada. So welcome, Dr. James. I'd also like to introduce to you Dr. Tasha Sullivan. Dr. Sullivan is actively serving as the director of the Counseling Center, promoting student wellness. She believes that individuals are the experts of their own lives and that counselors play a supportive role assisting people through life transitions, treatment, and the journey to healing. Dr. Sullivan enjoys helping others and approaches situations with a student-centered perspective. Her current role is in overseeing the overall operations and growth of the UTCC, with her aims set to continue building partnerships across campus and the community for the benefit of students. She has 4 years of experience working specifically with the college student population and immensely enjoys it. She has worked with individuals from various elements of diversity and has an active interest in social justice counseling, women's issues, self-esteem, trauma, mood disorders, and relational issues. Welcome, Dr. Sullivan. I would also like to introduce to you Dr. Linda Lewandowski as our commentator. Dr. Lewandowski is a prolific leader at the University of Toledo. She is the Dean of the College of Nursing, where she is also a tenured professor. She is also Vice Provost for Health Affairs for Interprofessional and Community Partnerships and Interim Inaugural Executive Director for University Campus Health Services. She has over 4 decades of experience as an academic educator, administrator, researcher, clinician, and consultant. A registered nurse, clinical psychologist, and scholar, her research program focuses on violence and cumulative trauma in high-risk groups and high-risk situations. She co-developed the Cumulative Trauma Scale, now translated into 6 languages and used worldwide. Thank you so much for joining us, Dr. Lewandowski. We really look forward to your input. I'm going to take a quick peek. I don't see Iris. So we'll go ahead and get started. I have some wonderful questions. I'm really looking forward to a wonderful dialogue. I'm going to pose this question to the group to answer. Please chime in as you see appropriate. We're going to start broad and kind of chisel away at the more details and more specifics as we go along. But starting broadly, how would you characterize the state of women's health today? What are the challenges and what are the opportunities? You want to start?
Sorry, trying to get that unmute. Well, good morning. So I think to answer your question about characterizing women's health, I believe it's still in need of improvement. Despite the modern medicine, women's negative health outcomes continue to persist, unfortunately. And when you look at some of the leading causes of death amongst women, 2 of the 3 are preventable. So we think about like stroke and heart disease. And then even with like early detection, cancer is the 3rd. And so I think there's still a lot of work to be done regarding equitable access to healthcare, coverage for healthcare, the opportunity to have support to actually attend appointments, because often women are caregivers in families and they're the ones that are providing the resources and support for other members to maybe get their health, and still maybe not always having the time to dedicate to their own health and well-being. And some of the things regarding mental health, women are twice as likely to experience anxiety and depression. And so I think when we think about the opportunities, though, we know that there's a lot more attention being given to the discrepancies of care for women. And so there's more dialogue, there's more conversations about policy being made. And so I think that's a strength because now it's not just kind of small conversations that women have amongst themselves, but that it's getting more advertisement, there's more traction for these conversations to be, on the floor for policy to be made. I think that there's still some challenges in that when we look at who's in power and who gets to make those ultimate decisions, often having women at the table to represent that voice still continues to be a challenge. I think that there's hope for improvement. I think there has been improvement, but I think it does continue to be a challenge for women for the state of health.
Yes. Thank you so much for that. Dr. Lewandowski or Dr. James?
Dr. James, did you want to take it next?
I was just going to say the hard part about doing this virtually is not being able to intersect or show support. I completely agree wholeheartedly with what Dr. Sullivan has said. And she succinctly put it all together that to add more to me is tough. One additional dimension is the societal and contextual way and challenges that women still face just generally in society. How are we seen as professionals? How are we seen in our roles as caregivers, nurturers, mothers, daughters, friends, all of those things? And how do we use our voice in each of those different circumstances and contexts? And I think that also comes to bear on women's health.
Yes. Dr. Lewandowski, anything to add?
Yeah, so I totally agree with Dr. Sullivan and Dr. James. And maybe could just talk a little bit. I think the previous speakers this morning have touched on some of the issues, but really relating to women's health. I think spending a little bit of time looking at the disparities, the differential impact of the COVID situation, in particular, of the isolation and the particular impact on women. We know no matter what age group, women have been impacted. And I was just looking at more studies this morning that show that in a greater way than men in terms of impact on their career, impact on how their mental health. One study I was just looking at from the Kaiser Foundation shows that 53% of women reported a significant impact on their mental health in the past months compared to only 37% of men. Another study, though, Total Brain survey by the organization called Total Brain, found that 83% of women compared to 36% of men reported a significant increase in depression. So we know that the differential impact on mental health for women is really very marked. Not only the isolation, the additional pressure of child care in addition to working, in addition to taking care of their home, in case trying to take care of their older parents and keep track of them who are in isolation, etc. But also another study was looking at women who are older women who would normally be very involved in taking like childcare with their grandchildren, out taking care of other people in the community, being active caregivers in many different ways. And now they're just home alone, isolated, unable to carry out their usual caregiving function. That is another group that, is really having an impact on, that this whole thing is having a significant impact on. So, I think we know a lot about the disparities of health disparities of women, just in terms of cardiovascular health. There are so many areas where women have already been identified over time, particularly women of color. All of these things are magnified, as we know, in women of color and women of lower socioeconomic groups whose jobs have disproportionately, again, either been eliminated or they have to be out as frontline essential workers while being paid, a fairly low wage and not having childcare. And so just all those kinds of pressures. So I kind of bring all those to bear, and maybe we can talk about some of them in more depth.
Yes, absolutely. I sometimes when I think about the state of women in health, obviously, like I said, starting very broadly, but it's really overwhelming to think about sometimes for all of the reasons that Dr. Lewandowski highlighted, and many, many more. I was just talking with my significant other the other day about I think there was a comic or an illustration of a woman working from home and had a baby under her feet and a pile of laundry at her side. And so when we think about all of the impacts, particularly right now, it's quite overwhelming. So I think that segues really well actually into kind of the second topic that we wanted to talk about.
And Erin, can I just call your attention that Iris has been able to join us now? So
yes, I saw that. Hi, Iris, thank you for joining us. Did you want to, we had just discussed our first question about the state of women's health and the challenges and opportunities. I know that you just got in, but did you want to take an opportunity to say anything? Find that mute button. Okay. Must be having some technical difficulties. That's okay. We can definitely come back to that. So as I mentioned, the second group of questions that we had centered around this past year of difficulty for many Americans. We have coronavirus, we have issues of systemic racism that have really have of course always been there, but have kind of come to the light this year, financial hardship as a result of the loss of jobs or working at home, and the very contentious social and political climate. So again, very, very overwhelming. How are the multiple traumas of 2020 showing up in your particular work? And can you speak to any local initiatives that are underway in your area that are meant to address these traumas and improve these health outcomes?
And okay, I'm unmuted.
Okay, good.
Was that question directly to me?
Not necessarily, but if you have something to say, we would love to hear it.
Well, I think in today's environment with COVID, we're seeing a lot of, as you said, multiple traumas. Early in the COVID, we saw personally, in my area of healthcare, we saw people having difficulty with access to healthcare, the routine, non-urgent type of healthcare that women needed. We were fortunate at Planned Parenthood. We kept all of our health centers open. We had the access to personal protective equipment, and we felt that there were urgent needs. A woman's reproductive health care needs are fairly important, and many women could not get into their other primary care. So our patients, as well as new patients, were able to come and visit with us. And we also brought up telehealth, which is a major opportunity because it made it even more convenient. I think what I would call femtech is something that more and more women are going to see a benefit of, whether it's telehealth or apps that allow you to track different elements of your reproductive health. We use a chat and text mode that allows people to ask a question. And so I think that a lot of the trauma that we saw outside of the healthcare, obvious, with people losing their jobs, right? And then schools being closed. So there was an incredible burden on women, especially during COVID. And and that continues. And, you know, at this point, it looks like it's getting worse as opposed to better.
Yes, to speak to the telehealth, I know, in my particular area of reproductive health as well, I know a lot of kind of concerns that were apparent at the very beginning was the inability to bring children along to visits because of the limitation of people in the exam room. And so I know a lot of women were really responsive to the availability of the telehealth because they didn't have to leave their home. And I have done many telehealth visits with, mom breastfeeding or babies playing in the background. And so, to really kind of take that burden off of mothers to be able to attend those appointments. But also speaking to the types of visits, I know that there were, even in telehealth at the very beginning when things were very questionable, we were not seeing any sort of non-urgent visits. We were delaying PAPs for 6 months or more. And I recently have been thinking about what kind of effects we're going to be seeing from those things. Because just because a visit is considered non-urgent doesn't mean that there's not a medical condition that's being missed. So I have a feeling, just like with the whole of COVID, that we're going to be seeing long-term effects of everything that happened for years and years and years to come. So
sure. We know, Good Markets did a research study, a very large national study at the height of the pandemic. And we know a number of things. Women said, about a third of women said they wanted to delay having children or not having children. Another third were concerned about getting access to reproductive health care. And they were concerned also about the price. And I think, as we look at women, about almost half of people in this country are get their insurance through employment. So as unemployment increases and goes on and delays, then access to health care becomes even more of an economic issue.
yes, absolutely.
I wanted to interject as well, Erin, because you mentioned something in regards to delays in so-called routine care, like pap smears and other things that are deemed non-urgent. We've seen a troubling trend on our end. So again, my specialty is in cerebral vascular disease. And one of the concerns on our end are people who are presenting late for acute symptoms. Yeah. And so people who have coronary artery disease, patients who have strokes and have their symptoms and then come late to the hospital, or I shouldn't say late, I should say delayed, and get timed out of acute treatments and end up having worsening outcomes. And this is outside of one of the things where, and I apologize in advance, it's just like my bias of where I am. One of my concerns with women's health is sometimes our predilection to limit it to our reproductive system. Women's health and the disparities that come as a part of that are integral to multi-organ systems that end up getting neglected or end up not being paid attention to, depending on whatever societal context. And I think in the current pandemic, what we have seen is an even greater divide in terms of access for other acute medical conditions that may or might not be addressed. Again, if you're the sole caregiver, if you're the only one at home, if you're the one checking on all of your other loved ones, are you taking the time to take your blood pressure? Are you taking the time to follow up with that occult blood that you were supposed to send of your stool to make sure you're following up with your preventative care? So I think we are going to see the effects of not only delays or changes in addressing reproductive health, but for women across the board, the research in the years to come are going to bear that out.
Yeah, I definitely
Absolutely.
would agree with you. One of the things that we're really working hard is to exactly say that to our patients and to other people to come in, have that annual exam, have that visit, make sure we're checking everything, and where you need to have a referral to have that happen. Because I do think that people, if they were able to get care during the pandemic, they're like, okay, that piece is done. But the reality is there more general health care. And I think some people are maybe afraid also to continue to go into hospital settings. So I would agree with you. The more we get the word out to really look at your whole health and not just a particular part, the better all of our women will be.
Yes,
And that's
and I know
really,
Dr. James. Oh, sorry. I was gonna say, I know Dr. James touched on it just a tiny bit, but even access to medications when people are not working or have lost insurance. I know many people have to make that choice between which medications they make or they may take, and that may be those cardiologic medications or those kind of stroke prevention measures. So yes, Dr. James.
no, I was just going to say too, another area that's typically left unexplored, and it's going to be interesting to see what the future holds, are the trauma and the toll of the caregivers within hospital institutions. So
Yeah.
our staff RNs, ICU physicians, I'm one of them, although I didn't carry the brunt that some of my anesthesia colleagues have and did and are still doing. What is going to be the toll on them as we move forward? And it's not readily discussed because in healthcare, there's this, I guess, super person kind of deal, but how we're dealing with that and what is going to be the fallout from that, I think is going to take some years to know as well, because there's definitely been trauma. Working in a hospital setting is inherently traumatic because you're walking alongside people as they suffer or as they have an acute change to their baseline that takes them, so far from what they consider normal, and having them, regroup and come back into that, and also supporting their families. So it's already inherently traumatic and inherently difficult. And now on top of that, with some of the difficulties that were already present in the healthcare system, now we have a pandemic, and now we have the social trauma that has always been there of systemic racism that rears up. And so it's going to be interesting to see how the professionals in that space are dealing with this now and in the future.
Sure. I would agree. I think also, even before COVID, if you think about, especially in Ohio, we have a lot of issues. We have, wage gaps. We have, not great access to affordable childcare. We have housing insecurity. And so when you compound that for some people, and as the doctor said, institutional racism, this is doubling the problems that people already had. And there doesn't seem to be a lot of solutions. And if you think about what will that do, how will that set women specifically back? You're set back in your job, you're set back in your career, your children are set back. And I think for mothers to see their children lose ground in their education is a double whammy. And we could lose years of progress in terms of, your own personal growth, the hopes and values that you had for your children as they, make it through their education system. So I agree. We don't have any idea of what the overall impact of COVID will be on our society, and especially women who, women who are with a partner who's violent and you have no place to go. I think we still don't know how damaging that has been.
Yes, I was speaking to a social worker recently who said, and this is anecdotal, but that CSB referrals are way down because of online learning, because the kids aren't in schools right now. And I know that is also kind of a similar concern for domestic violence, like Iris mentioned. So I guess, so as a follow-up to that conversation, and this is maybe even harder to answer, what can we do to take care of ourselves and our families in this time of this trauma? You know, it does sometimes seem like we're grasping at straws, but how can we do this? How can we take care of ourselves?
Erin, can I jump back a little bit though,
Yes.
and kind of link the two together maybe? If I think I became an observer for a moment in the panel instead of a participant because the dialogue was so rich. So I am in the mental health field, and we specifically work with students. And so some of the things that we started to really see were an increase in the social isolation of students, as well as that depression and anxiety. We also saw a lot of things like regarding people's exhaustion and sleep disturbances. So people having an inability to sleep, you know, or feeling like they're falling asleep or waking up consistently through the night. And so that became present, as well as experiences of fear, and then grief and loss. And I want to particularly speak about that just really quickly, there was the loss of, we were watching social racial tensions, you know, elevate and escalate visibly. The increase of people showing videos of traumatic experiences of death of individuals. And so that even if it wasn't a person that they knew, you know, personally, there was a representation and a reflection of someone they could have known, right? And so there was a lot of lost experience from individuals in that regard. But then also for our students, particularly, they had a lot of experiences of loss of experiences. And so there was this grieving process, or a lack of grieving of, you know, missing graduation or celebrations or opportunities with family, that really created some disconnect for individuals. And so to answer your point about like how people, I think you said like, what's one thing that we can do to take care of ourselves, or things that people can do. I think one is we have to normalize that this is not a normal time, that it's okay to have a response and reaction, because I think some people are trying to power through and I shouldn't have a feeling, you know, that's negative and I should just be okay. And it's like, well, who says that you shouldn't have a response to a pandemic, to racial tensions, and socio-political conflict? Like, it's normal to have a reaction response to that. And I think we have to create space to do that. Allow people to find their safe spaces to have those dialogues and those discussions, as well as prioritizing self in some regards. I think, especially as women, we often are caregivers and we don't put ourselves first on the list. We often, if we're on the list at all. And so I think it's a time opportunity to reframe that. And so a lot of medical and mental professionals use that example of, if you've ever been on the airplane, and when you are on the airplane, the stewardess comes and they give instructions for like where the exits are, and that if we lose cabin pressure, masks are going to come down. If you're with an elderly person or a child, they say you to put your mask on first. Because if I'm trying to help you and don't have my mask on, we both could perish, because now I may lose oxygen in the attempt to help you. And so it's not selfish to take care of self first. And I think sometimes we get that confused. But if I'm not well, how am I going to take care of all the other people that depend on me or rely on me for well-being? And so I think this is an excellent time for us to refocus and to reframe the concept of what caring for self is, to say that caring for myself is not selfish, it's necessary for my sustenance, but also for my community. And so I think it's important for us to exercise some self-compassion and to continue to acknowledge that, you know, our responses are normal, that we're going through something as a collective, as well as the individual experiences that we're having. And so giving space for that, so that people can not feel like they are not missing a mark, that they're failing. I think that sometimes comes up as when we talk about the strong woman. And what strong is often is really unhealthy definition. It's really saying that like we don't have experiences that are negative, which is not true. We do. We often are resilient, which also means that we adapt, but that doesn't mean that we are free from obstacles. And so I think this is an opportunity for us to really give face to that, give voice to that, and also practice and demonstrate it for other women in our lives. So taking that moment for that self-care, that well-being, and engaging in dialogue to say like, you look like you might need a mental health day. You know, hey, maybe a nap would be something that, you know, can we create an hour in your day to do that? And so I think that prioritizing ourselves is something that we have to learn how to do and not feel guilty about.
Yeah.
I heard, go ahead, Dr. James.
No, I was going to say, and to Dr. Sullivan's point, I'm so glad one of the positive silver linings out of this pandemic is I hope the death of the, especially for Black women, the superwoman complex. Like, I hope we're finally going to put her to rest. She's exhausted. And that whole concept framework has to go. The power of the collective and being able to integrate, come together, share our experiences, again, in trusted, safe spaces, like not with everyone, but to be able to do that, it needs to start, because not only are people suffering in the lower socioeconomic status, what is truly frightening is that we tout education and money will get you out of certain health consequences. And in Black women, that simply is not true. It doesn't matter how many degrees I have, my rate of mortality, of maternal mortality, and the mortality of my unborn child is just as high as if I didn't go to high school or didn't complete high school. And so to get out of the trap of I do everything, I carry everybody, and my feelings aren't important, I think this is one of the areas in which we can stretch and grow within this pandemic. And I really appreciate Dr. Sullivan bringing that forward. She has to go. The superwoman, it's time for her to go. We can dress up and put on heels and capes or whatever else, but this all encompassing, I'm every woman and I do it all, is really, I hope, falling to the wayside.
Dr. James, I'm so glad you said that. I'm so glad you said that outwardly, because I think it's, as a strong Black woman, right, as that superwoman complex of embodying that at times or striving to, it's our role to not feel like we have to, but also we need the people around us to not expect that of us as well. And so I'll share that I had a child during the pandemic while being director of a counseling center, while being a caregiver of another child. And so that challenge of, for a long time, I didn't tell people that I was pregnant because of the fear of what they're being perceived that I won't be able to do what needs to be done, right? But then also fighting the internal battle of needing to reach a particular standard and expectation because of the perception of being a superwoman. And so I think it's a twofold. It's a not feeling like you have to embody that in practicing being a human, and knowing that being a human doesn't mean we have to overachieve and do everything for everyone all the time, but also other people not expecting that and putting us in impossible situations as well. I think it is important. So I really appreciate you being very candid there and calling the elephant in the room about that superwoman complex, because it is very dangerous.
Because that leads to, and I'm sorry, I don't mean to hijack this, Erin. I know you're trying to moderate us and keep us.
Go on.
But that is such a huge problem, because again, when we look at some of the social determinants of health, or what puts, especially BIPOC, so Black and Indigenous and women of color, or people of color, but specifically today we're talking about women. So what increases, let's say, maternal morbidity and mortality? And morbidity meaning like what makes us sick, right? After we have delivered a child or do whatever it is in terms of reproductive health. Why are our outcomes worse? Well, chronic exposure to hypertension, increased BMI, decreased ability to get whole foods, nutritious foods, especially for those of our communities who are in a lower socioeconomic status. If we take that out, so I can get access to nutritious food and I'm earning whatever we say we earn, why do women in these higher socioeconomic levels still suffer the same degree of mortality? Why does my education not rescue me out of that? Well, endemic systemic racism. I can still get pulled over and shot depending on whoever's mood, one. Two, the persistence of some of these other risk factors that I may not be taking care of. So my high blood pressure, that's just a stress headache. I blow that off because I need to make sure so-and-so is okay. And then three, because some of us do this so well, we've engendered an expectation that once I'm in the room, it's completely taken care of. And we don't want to ask for help because it's a sign of weakness, because again, we've been pushed that if we don't show ourselves to be strong in everything, we will have nothing. And again, that comes out of the sad history of slavery and colonialism that's happened. But women, especially in general, especially marginalized women, have always had to carry these phenomenal loads with very little help, and then told, you're equal to everybody else. I can't be if I'm carrying that load. And so what I've been very intentional about, especially through my training, and I've had the benefit of a really supportive family and inner circle, but being very intentional about asking for help, about sharing, again, in safe spaces. And what are some of those safe spaces? A mental health professional, a therapist, a trusted friend who isn't, trying to claw you down, but is actually lifting you up, which I've had some phenomenal women, mentors, coaches, sponsors who have been that for me. And changing the expectation of what a strong woman looks like. I am strong if I ask for help. And it's not because I'm deficient, it's because the task at hand demands many hands. And I think that expectation and that shift is going to have to start to happen if we're going to start to see a shift in some of these indicators of poor health, especially in marginalized communities.
Yeah, I would agree. And I think one of the things we might also see within the home is as women are put back into a position of losing some of the power of what they want to do for themselves and their ability to succeed in the way they define it. And maybe they're still the caregiver in the home with additional expectations, that you could also see some new inequity in the home that many women had an opportunity to move out of. So it feels as though we could end up being pushed back from good mental health, good physical health, from whatever position we aspire to in our communities. And again, it is sort of that super women. I think we have a lot of, if you will, in the popular culture, you're seeing a lot of this super women being thrust on us again. I mean, if you think about, we were all holding our breath that what Stacey Abrams did politically, that she would be able to pull it off in Georgia, the ability for Kamala Harris to move into that spot. And those are all great, good role models, but they also are role models that have come with it with a great deal of expectations that in some ways we never can live up to those expectations because they're not often defined by us. They're defined by the hope of everyone who sees the progress being made and are hoping that will bring along the next generation. And it's a lot for any individual to bear without having, you might say your squad, as you said, Doctor, do you have the best friend that you talk to every day? Do you have a trusted person that you can say, this is not a good day for me? Do you have the resources to, just pull away from the tension of every day? And I think a lot of women don't have that opportunity right now.
One of the examples that I think about the most, and that really comes to me, especially in times where I'm overwhelmed with work or whatever, what have you, is Erica Gardner. So the daughter of Eric Gardner, the gentleman, and forgive me because I can never remember years. I'm terrible with historical years and facts, so you'll have to forgive me. But what breaks my heart with her is what you mentioned, Dr. Harvey, about expectations and the load of carrying an agenda or a task for everyone else. So she stepped up as an activist after her father was murdered.
Right.
And before the age of 30, a mother of 2 is dead from
Dead.
cardiomyopathy or
Right.
complications related to cardiovascular disease. How is
Yeah.
this possible? So we're losing activists, we're losing professionals, we're losing people who have the potential to change the world. And in the short time that she did, she was already established herself as a unique agent of change,
Sure.
and then gone too soon because who was checking her blood pressure? Who was making sure that she was eating? Who was addressing, as Dr. Sullivan mentioned, lack of sleep? We're seeing more and more that disorders of sleep are contributing to hypertension, stroke, cardiovascular disease, somewhat similarly in the way that atherosclerosis or lipid deposits do, right? That link is becoming more and more concrete, and we've just scratched the surface. Who was looking at her for those things? And this is something, she's already had children. So these are issues that are outside of her reproductive function. And I keep going back to that because, again, for women, our health tends to be pigeonholed into being able to bear children or menstrual cycles or other issues just related to that specific organ system. But here we have someone, I question whether or not she really even had the space to grieve. Her father is gone. And through all of that, still got up, still picked up signs, still protesting, still looking after her kids, and before 30, gone.
Yeah.
And so with examples like this, and there are probably huge numbers that we don't know about because, they don't have a camera in front of them to represent them. That's one of my fears or concerns. And one of the things that we need to be intentional about, especially as professional women, as we continue to climb and advance and to change our environment, being very specifically intentional about what those expectations look like and what we can carry. Because the people behind us and around us are watching. And if we are doing so much work to change the water, we have to make sure we don't drown in that work as we're changing things. And too many of us have drowned. And too many of us haven't just drowned and been killed. That's bad enough. Too many of us have been injured and can't move on with the work that we've been doing.
Yes, that was, gosh, so very moving, Dr. James. Thank you. Thank you very much. I want to say I particularly appreciate the reminder that women's health isn't just relegated to the reproductive system. Obviously that's my area, so that is where I always think. But yeah, I mean, we are definitely so much more than that, and also those disparities affect all those other organ systems as well. There is not just racism in obstetric and gynecologic healthcare, but all healthcare. So I want to really thank you for that reminder. We're getting close to time to wrap up. So I want to just pose one final question to the panel in order to kind of end this session with kind of some ideas for our attendees. Everybody always kind of wants to know how to help, and I think it's particularly difficult in health and healthcare because not everybody is a healthcare professional. Not everybody has kind of the opportunities to do the things that they think that can help. So any actions, ideas, pet projects, legislation that you are especially passionate about that is going through our government, and how can our attendees leave this session today with something concrete that they can do?
Well, I would say, one of the things that I think is really important is that I'm disappointed we're not getting the minimum wage increase. And because when you think about how little $8 or even $15, we know that, a family of 4 cannot live on $15 an hour. So I do think we need to lift the things up in our society that give people at least the financial needs, the financial tools to fight off poverty and for them to pursue some of the wishes and dreams that they have, and for them to have great access to health care, for them to have great access to secure housing, for them to believe that their kids can go to a good school. And a lot of it does have to do around access to finance. And I think the living wage is something that we really should keep our eye on, because between the wage gap between men and women, and then the overall low wage, and women, especially in Ohio, have probably half of or more they hold most of the low wage positions. So I think if nothing else, if we could have more financial security, right, then that gives us an opportunity to make different decisions, to feel in control, and to have access to things that keep us healthier.
If I can kind of summarize some of the things that I've been listening to, I guess that's what I'm supposed to be doing here too at the end. I wanted to kind of pick up though on what our other panelists have been talking about. I think it's so important to look at who are the vulnerable people around us, and we kind of are able to identify, I think often, or when we're in a setting like this, at least, of we know, women of color, women of low SES, we kind of identify some high risk groups, but I think there are other groups too that we need to be focusing on. Dr. James brought to our attention the healthcare professionals. We know that the suicide rate in nurses has really gone up, probably physicians and other healthcare professionals too. That's pretty well, there have been some pretty high, actually, profile suicides of a young woman, ER physician, early on in the pandemic. The pandemic has been taking toll on a variety of people in a lot of different ways. And I think another group I just became more aware of that I guess I just wasn't tuning into are Asian Americans. One study, I just sent Dr. Sullivan the link. I promised I would send her earlier in the week, of a study in Scientific American that was just reported that shows that the rate of depression in Asian Americans are up 5-fold because of all of the, racism really that they've been experiencing, with COVID being called the China disease. And the impact has been really quite major on the Asian population. We don't often hear about that. So, I think that there are many of us that have been impacted in so many different ways. And the whole idea of self-care and women, I think, is kind of a new idea for many of us. We're the caregivers. We take care of other people. The expectation is mom or grandma or aunt, Erin, or whoever it is going to be the one taking care. And a strong woman would just be able to keep going and just keep taking care and not complain and not focus on their own health. And we've had kind of too much of that focus. We've kind of identified in the superwoman complex, but that is a big problem, I think, particularly in professional women, perhaps, but I think all women have that sense that taking time to care for themselves is sort of an indulgence. They might feel guilty about taking that time, when in reality, we know self-care is like so important. So I think one of the takeaways I would suggest to this professional group is that we need to get better being role models in our agencies where we work, being able to say, gosh, maybe I can't do it all. For some of us, I know for me, I feel like I came out of, I don't know, with the COVID, I was just in my house. I wasn't out exercising. I gained weight. And I'm sort of like maybe a month or two ago went, oh my gosh, what's happening? I need to get back to take care of myself. And I think many people are starting to have that recognition. We were just in such hyper crisis mode with COVID and racism and the election and political strife and, you know, people losing their jobs and just trying to keep it together, that taking care of ourselves, getting to our appointments, you know, things that are just basic, going to keep us going and in good shape so that we can do all the kind of caretaking. You know, we haven't been doing that. So I think to the extent we can look at how can we be role models? How can we take those first steps, not only to do self-care for ourselves, but looking at in our institution, in our agencies, you know, our offices, you know, is there a way that we can kind of not only role model, but, you know, try to take the lead in looking at how do we start to have a focus on health being a priority for women across the board. And I think that, you know, the people who are here at this conference are the leaders and the movers and shakers who can make that happen. If any women can, this is a group of women that can. So I just sort of challenge everybody here to look at how can you start doing more self-care, but how can you get more of the women around you doing the kinds of things, getting to their appointments, you know, getting their basic preventive and care, getting their blood pressure taken care of, you know, all the kinds of things that we need to do, taking care of their mental health, noticing when somebody's mental health is not so good, and, you know, trying to help them get some support that they need. So that's my challenge to everyone here is like, let's look at what we can do, because it was a very impressive young woman that Dr. James talked about, who was really on her way to changing the world. But I think we all can change the world, our own world, you know, our part of the world. And so I kind of challenge everyone to look at how can you do that? How can you start to make that change and that difference to change your world?
Like how could we as women take care of women, take care of the women around us and
Because we take care of everyone.
yeah, right. It's just adding another list. Yes.
Well, I do want to say one thing, and maybe in a little bit of a different direction, especially as we wrap up, because I feel like there was so much more we could have gotten into, but this was short. To quote Toni Morrison in Beloved, we are our best thing. And I hope in all of this, one thing that's so hopeful to me and what continues to give me hope is that I can do, even in my own small circle, by taking care of myself, by knowing my blood pressure, like my shoe size, and some of my other numbers, like I know, you know, the kind of hair I want to put in or whatever, that I need to congratulate myself for the good things I do for myself. And that's one of my wishes for women everywhere, of the entire gender spectrum, from marginalized groups, everybody, that we can start taking the steps to congratulate ourselves for being here, for showing up, and for being our best thing. And by accepting that challenge, not only to model that to everybody around us, but to really turn that into ourselves and really be that inner light for ourselves, because we have it. We have it. So many of the people here, you've already got it. The question is, are you celebrating it? And are you making it something that's important to you? Because you can't expect everyone outside to see it and make it important to them if you haven't prioritized it to you. And so one of my wishes for women is that we get better at giving ourselves a round of applause for what we are already doing and where we are already standing.
That is beautiful. I love that.
That's a beautiful gift.
Yes. Yeah. We are at 12 o'clock. Angie gave us until 12:05. Does anyone have anything else to say to wrap up? Dr. Sullivan?
Yeah, I didn't want to, anyway.
No?
Just to echo on Dr. James's point, I love the idea of us recognizing ourselves, celebrating ourselves. I think, and also, you know, lift as we climb, like being mindful of our other women that are our peers that are next to us, creating space for, as what Dr. Lewandowski said, being the model, like an example of what self-care is, but then also encouraging other people to do the same and normalizing that. I think that we have a great responsibility to demonstrate the changes we want to see. And so there are going to be times where we may have to exercise a no in spaces, and being able to normalize that, to say that it's okay to have boundaries, that boundaries are healthy. And so I think that a takeaway I would encourage individuals to think about even is that well-being is more than one thing. Well-being is our physical, our mental, our spiritual, our emotional self. It's how we connect with other people in our community and our environment. It's our professional and educational development. So wellness is a conglomerate of multiple things. And that for us to have balance, we have to think about all these things on the plate as though they're round things, and that we don't let anything completely roll off of the plate. And so when we find ourselves in a space where we feel lack or we feel disconnected, to do some self-reflection to say, are my needs being met? And in what areas might I need to put more attention to? Because I think that sometimes because we're moving so fast, because we're caring for so many, we often forget to think about all of our needs. And sometimes our difficulties are because something that was important to us was left off the plate. So whether that had been sleep, whether that had been eating a nutritious meal, if we had access to that, whether that had been connecting to people that we love and making sure that we're having that emotional connection with people in our world. And so it's really important that we intentionally think about our own well-being and all the facets of that, and being intentional about how we let that show up in different spaces. And if we are and have the option, because we don't always have the option of where we are in our lives, and sometimes, but if we have the option to let those things show up in different places, whether it be our work, whether it be in our relationships, whether it be in our recreation, that we allow ourselves a space to actually exercise those things, and have some social agency in the way that we show up in spaces, authentic to ourselves. I think sometimes because when we talk about that strong woman complex, we also didn't talk today about having to wear masks in certain spaces where we can't speak up in certain places. And so knowing what our voice is, but then also knowing what our needs are. And so we have to give some self-reflection to know that need. And so taking that time, it's okay to say, like, today was a really hard day. What was so hard about this day for me? Did I have things that I needed for myself that I wasn't able to attend to? How might tomorrow be different for me? How might I find spaces where I have choices that I didn't get the opportunity to exercise today? How might I find people that support me, right? How might I build my community in ways that help me be well? How might I find resources and organizations and pieces of education to continue to empower myself, but then also putting someone else on to that to say, like, hey, Erin, there's this great women's summit that I'm going to attend on Monday. I would love for you to participate because there'll be other women in that might be able to provide great support for us. There might be information that we didn't have before. And so sharing the things as we're experiencing them, but also taking the time to make sure that we're getting what we need. And again, go back to that theme earlier, is not having to feel guilty about that, normalizing that our well-being is important too, because our community actually rests on us being well.
Mm-hmm. Yes, you can't pour from an empty cup. So, well, that about wraps up our time. So I want to say, first of all, thank you to the Eberly Center and the University of Toledo for having me as moderator. It's really been an honor to speak to all of you, amazing, intelligent, and beautiful women. I want to say thank you to Dr. Elysia James, Dr. Tasha Sullivan, Ms. Iris Harvey, and Dr. Linda Lewandowski for your rich and stimulating and wonderful conversation. This has just been such a great experience. So thank you so much, everybody. And I don't know, Emily, are you taking us out of here or do we wait? Oh,
It was nice.
All right.
It was nice to meet everyone.
Well,